Feeling overwhelmed about your first rheumatology appointment? Let's remove the guesswork. I'm walking you through everything, what to expect, what questions to ask, and how to get the most out of it. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health using thoughtful, cutting-edge treatments that reduce your risk and improve your quality of life. Let's talk about what really happens during your first rheumatology appointment visit. For many people, getting referred to a rheumatologist feels confusing. You may be asking, why did my doctor send me here? Is this serious? Is this arthritis? Do I have an autoimmune disease? Will I need to be on medication forever? These are all valid questions. Whether you're dealing with joint pain, fatigue, swelling, autoimmune symptoms, or you're still undiagnosed, your first rheumatology visit is the start of a very important conversation. This video is your roadmap. We're going to go deep. We'll walk through every part of the visit, step by step, and by the end, you'll know what to expect, how to prepare, what questions to ask, and how to work together with your rheumatologist to get the care that you need. So, why were you referred to a rheumatologist? You may be surprised to find yourself here. Maybe your primary care doctor saw something on your labs. Maybe your joints hurt, but your x-rays are normal. Maybe your fatigue is unexplained. Or maybe your mom had lupus, and now you're wondering about that strange rash and stiffness. Here's the truth. Rheumatologists are medical detectives. We evaluate complex, chronic, and often subtle medical conditions that involve inflammation, the immune system, and the musculoskeletal system. Some of the most common reasons people are referred include ongoing joint or muscle pains, unexplained swelling, fatigue, rashes, fevers, abnormal blood tests like an ANA test, rheumatoid factor, or CCP antibody, concerns about autoimmune conditions, and sometimes it's because you just haven't gotten answers anywhere else. And that's okay. We're here to slow down and figure things out. Before we start ordering tests or jump to conclusions, we need to listen. We want your full story. This is one of the most important and overlooked parts of medicine. In rheumatology, your history is the diagnosis 70% of the time. Here's what we want to hear from you. Where you hurt, when it started, how it changed over time, what makes it better or worse, morning stiffness symptoms, family history issues, any history of rashes, ulcers, hair loss, dry eyes, dry mouth, any previous injuries or surgeries, and what medications you've tried, what worked and what didn't. You're not just checking off symptoms, you're painting a picture that helps us understand your disease timeline. The labs may not give us a clear answer, but your story will. Now that we have your story, we go hands-on. This is where rheumatology differs from many other specialties. We're not looking for just one joint problem, we're looking for patterns. We'll evaluate, to begin with, your joints. Are they swollen, red, stiff, or tender? The muscles, are they weak, tight, or tender? The skin, any relevant rashes, lesions, or nodules? The nails, any pitting, lifting, or ridging? Eyes and mouth, any dryness symptoms, redness, or ulcers? The nerves, any signs of neuropathy? We'll check every major joint, head to toe, even areas you didn't think were relevant, like your jaw or your toes. Labs are also potentially helpful, but only in context. Let's break this down. Inflammatory markers, your SED rate, your CRP, these tell us if there's inflammation, but not necessarily why there's inflammation. They can be elevated from infection, injury, or autoimmune diseases. Then there's autoimmune markers. The ANA test, seen in lupus and other autoimmune conditions, the rheumatoid factor anti-CCP antibody that are specific to RA, an HLA-B27 test, seen in ankylosing spondylitis and related conditions, an ENA panel, SSA, SSB, RNP, etc., antibodies. These are found in other types of connective tissue diseases like Sjogren's syndrome, lupus, or mixed connective tissue disease. It's important to note, many healthy people can have a positive ANA. That doesn't mean you have an autoimmune condition like lupus. And many people with autoimmune diseases can have normal labs early on. Again, the full clinical picture is how a diagnosis is made, not just one lab test. Next is imaging. X-rays can show structural changes. Ultrasound can detect real-time inflammation, fluid, and erosions in the joints, often before X-rays show any changes. MRI can help identify subtle inflammation in the spine, SI joints, or soft tissue issues. This is not guesswork. We use a layered, evidence-based approach to make sense of your labs and symptoms. Here's where we put it all together. We ask, is this inflammatory, mechanical, or neurologic? Is there systemic involvement affecting your skin, eyes, or other organs? Is this early disease or something that's progressed over time? Some conditions we often diagnose at first visits. That can include rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, lupus, Sjogren's syndrome, polymyalgia rheumatica, osteoarthritis, and fibromyalgia. Sometimes the answers are not yet clear, and that's okay. Some autoimmune diseases take time to declare themselves. We monitor and revisit. It's not about rushing to label you, it's about understanding you. Let's discuss our treatment philosophy. Low risk first, and then a personalized approach always. This is what sets us apart at Chicago Arthritis and Regenerative Medicine. My guiding principle is start with the lowest risk, most effective option. Escalate only when it's absolutely needed. So here's a framework I would use with every patient. If you have mild condition, step one is conservative treatments. Anti-inflammatory foods, movement therapy and physical therapy, mind-body practices to manage stress, supplements like turmeric, omega-3, glucosamine, vitamin D, and sleep optimization. Step two, if you have more of a mechanical or degenerative issue, regenerative medicine treatments can be helpful. If your pain is caused by instability, tissue damage, or early arthritis, we may consider prolotherapy, injecting dextrose to stimulate healing, platelet-rich plasma or PRP, using your own growth factors to heal tissue, or bone marrow stem cells for more advanced damage. These are all image-guided treatments, all personalized, and all are non-surgical. Next are medications. If your condition is moderate or severe and involves inflammation throughout your body, and particularly if there's risk of progression, which we can document and identify based on imaging and other labs and other examination findings, we will typically recommend a disease-modifying treatment, which can include methotrexate or hydroxychloroquine, or for more significant conditions, a biologic treatment, which can include TNF blockers, interleukin-17 blockers, JAK inhibitors, or other medications. And on occasion, short courses of anti-inflammatories, trying to avoid chronic steroid usage, however. Medications can be life-changing when appropriate. And in those cases, we use them wisely and monitor closely. What we try to avoid is over-reliance on steroid injections, which if given too often can degrade tissue over time, radiofrequency ablation treatments that destroy nerves, and unnecessary surgeries, especially ones that remove tissue and cause instability. So what can you do to prepare and succeed for your visit? Your visit is a two-way street. Here's how to get the most out of it. Before your visit, write down your timeline of symptoms, bring prior labs and imaging, list all medications and supplements that you're taking, and bring 2 to 3 questions or goals for the visit. During your visit, speak openly about what's most frustrating and problematic for you. Be honest about how it's affecting your life. Do not downplay symptoms. This is your time to be heard. Take notes or bring someone with you if needed as well. After your visit, follow up on any testing you've had done that should be scheduled for you by your physician's office. Follow up on labs and follow up as scheduled with your physician, especially if your symptoms are early or changing. You also want to communicate any changes or concerns early on. Stay engaged throughout the process. You are definitely part of the solution. Here's some frequently asked questions and honest answers. Question that I occasionally hear, will I be on meds forever? Only if your disease needs it long term. Some people may improve with early treatment and can taper over time. But most autoimmune conditions are chronic and will require some form of treatment long term. Is this curable? Some conditions are manageable and not necessarily curable, but with the right approach, you can live a full, high-functioning life. I've seen multiple doctors and still don't have a diagnosis. Why is that? Autoimmune diseases can be subtle and take time to reveal themselves. A good rheumatologist watches closely, tracks progress, and adjusts the plan as needed. Another question, do we treat fibromyalgia? Fibromyalgia is a real condition and often coexists with other issues. We make sure to rule out or evaluate for inflammation and other structural issues as well. In the end, we end up treating all sources of your pain. That includes inflammatory issues, degenerative instability issues, and myofascial and neuropathic issues as well. Your first rheumatology visit is about understanding your story, not just checking labs. Diagnosis is a process, not always a one-time event. You deserve a plan that reflects your goals, risks, and lifestyle. Start simple, escalate treatment only when needed, and remember, this is a partnership, not just a prescription pad. If this video gave you clarity, please like, subscribe, and share it with someone preparing for their first rheumatology appointment. For more information or to schedule a consultation, visit us at chicagoarthritis.com or connect with us on our social media channels. Until next time, live well, be strong, and take control of your health.